Use of Integrative Therapies for the Patient, Parent, and Staff, a Family Wellness Program at Boston Children's Hospital. Disclosures: we have no financial interest related to this presentation. We have no conflict of interest. The three presenters are Diane Chella, Nancy Teller, Lorraine Bossy, all nurses who are Reiki masters. Nursing developed a family-centered wellness program that uses integrative therapies, meditation, Reiki, yoga, massage, acupuncture, to encourage self-care practices to reduce stress and promote healing for patients, caregivers, and staff. Our vision of the Family Wellness Center is to be the world leader in setting the standards for supporting the wellness of the entire family. The Family Wellness Program resides within the Hale Family Center for Families at Boston Children's Hospital. It is based on the nursing theory of caring science in the use of integrative therapies. Nursing has always been a holistic, integrative healing discipline. Nurses historically value whole systems and acknowledge the interconnectedness of all living systems and focus on the ecosystem. Nightingale recognized the importance of creating balance for restoration, quote, putting the patient in the best condition for nature to act upon him. The Family Wellness Program translates theory to practice. The clinicians offer services to parents and caregivers, patients, and staff. This program has developed in 3 distinct phases as funding has become more available. For the caregiver, caring for seriously sick children has an impact on mental, physical, and spiritual health of the caregiver. 40 to 70% of caregivers report clinically significant symptoms of depression and experience exhaustion. Caregivers report nearly twice the rate of serious illness such as diabetes, heart disease, cancer, and arthritis. And caregivers experience increased stress hormones, decreased immune response. A study evaluated nearly 1,000 mothers and 182 fathers with cystic fibrosis. 30% of the mothers met the clinical criteria for depression, double the rate of a regular sample. Based on the family patient care model and evidence-based science, it is imperative that we treat the parent as well as the child to promote well-being, stress reduction, and foster resilience. This was the first phase of the wellness program. The Family Wellness Program has been funded by Yoga Reaches Out and a partnership which has been developed with Boston Children's Hospital Trust. Over the past 3 years, greater than 1,000 parents have received Reiki, 1,000 received massage. It has doubled each year since its inception. Hundreds have participated in yoga and Zumba classes. When queried, 100% of the parents responding to a post-treatment survey report a 5-point reduction in stress on a 10-point Likert evaluation scale. Many parents have been in the hospital for months and years with their sick children, either waiting for them to improve and sometimes sadly to pass. Megan's baby was born with volvulus and as a result lost 80% of his large intestines. Megan and her mother came down regularly 2 times per week for Reiki and massage. They were hospitalized for 7 months. The wellness room was a port in the storm. It was here that she found comfort and support. By the discharge, Mother had taken Reiki classes and became Reiki certified and began the study of aromatherapy. When she returned to Nashville, she was an advocate of integrative therapies and brought these modalities to her community. And here's an example of the results of the studies that were done. And some of the comments, some of the quotes from the parents, such as, absolutely beneficial. I almost left in tears of relief. I can breathe again. Providing more information about this type of program would help parents. Thank you. Here's an example of our massage. In yoga, yoga with children, learning to calm themselves and to cope. And I'd like to introduce Nancy, who will talk about Reiki with the patients.
As funding has increased, we have been able to consistently offer complementary services to patients at the bedside. Referrals are called into the Family Wellness Center by parents or clinicians requesting Reiki, massage, or acupuncture, and a licensed clinician, such as a registered nurse or an acupuncture physician, will see the patient at the bedside. For massage and acupuncture, an order is required by a provider. Patient responses to complementary therapies are documented in the patient record. The staff are grateful that these modalities can be offered to their patients to complement their allopathic care. Complementary services are offered throughout the hospital to patients of all ages and across a spectrum of degree of illness. The range of responses from patients is varied depending on a multitude of factors. Sometimes a visual assessment is simply that the patient settle into a deep state of relaxation and fall asleep. Many are old enough and able to verbalize that the treatment offered was helpful and that they feel more relaxed. As a critical care nurse and Reiki provider, my combination of backgrounds allows me to utilize additional information to assess the responses to the Reiki that I offer to patients. Many of our patients are critically ill in the ICUs, where vital signs are continuously monitored, providing objective data in assessing patient response to Reiki. The subset of patients with chronic lung disease in the neonatal ICU has been noted to have reliable responses to Reiki. Objective responses consistently observed include decrease in baseline heart and respiratory rates and increase in oxygen saturations. The infants are generally noted to become less restless and settle into calm periods of sleep. This is especially important in this population because less agitation and better sleep maintain stability and waste fewer calories, which in turn supports better growth and repair of damaged lung tissue. One patient who was treated over a period of 6 months exhibited a consistent and dramatic response to Reiki. He was a former premature infant with end-stage chronic lung disease who was listed for a lung transplant. Despite maximal ventilatory support and significant amounts of sedating agents, he was frequently air hungry and agitated, leading to further decompensation from an already precarious respiratory baseline. His responses to Reiki were incredible. Within moments of hands being placed gently on his head and abdomen, his air hunger and his restlessness began to diminish. His baseline heart rate would drop from the 180s to the 120s. His oxygen saturation would rise from the desperately low 40s and 50s up to the 90s. And his carbon dioxide levels would drop from the 120s down into the 70s. All of this objective data indicated a strong and stabilizing physiological response to Reiki. His nurses and his mother requested Reiki often and were relieved when sessions were provided because his responses were so consistent and it was clearly helpful in maintaining his stability. Over the 6-month period that he was treated on a regular basis, there was only one time that his response varied. His respiratory baseline had deteriorated further, and there was concern he would not survive to transplant. On this particular day, Reiki was provided as usual, but no positive change in vital signs, as had been consistently noted, was observed. It was a change in his baseline, which was concerning to his mother and his caregivers. Several days later, we were sadly informed that the patient died of respiratory failure. Though he was not able to survive his illness, the ability to provide comfort and care to this patient and his mother through Reiki was a formative experience, providing much reinforcement to the importance of our work. We look forward to expanding the program to continue to support and learn from our patients. And now I'd like to introduce Lorraine Bossy, who will talk about the educational component of our program at Children's.
The Parent Wellness Program offers Reiki classes to family caregivers as well as to clinical staff. Family classes are offered in multiple 2-hour modules to accommodate family members' schedules and time away from their child. To date, we have offered more than 40 classes to more than 100 family students. Reiki classes for clinical staff are offered in a one-day format, which awards accredited clinic contact hours. To date, we have offered 11 Reiki 1 classes and 5 Reiki 2 classes to more than 150 clinical students. Content for all classes contains recommended topics and experiences. What is Reiki? Reiki brings a universal healing energy, or Rei, to the individual's life force energy, or Ki, to repattern, rebalance, and heal. Through the use of a present touch or non-local means, the Reiki practitioner offers Reiki to an individual who accepts the energy and whose essence encourages the energy to flow to where it is needed. In 1922, Makai Usui, a Japanese Buddhist, introduced Reiki to his students. Reiki practice acknowledges each person's uniqueness, upon which the connection of its healing energy is based. Reiki practice philosophy emphasizes the importance of establishing a self-care practice as the foundation for offering Reiki to self and others. The Reiki principles provide a guide for daily practice. Just for today, I release angry thoughts. I do not worry. I am grateful for many blessings. I practice expanding my consciousness. I am kind to others, including myself. For staff who are trying to prevent compassion fatigue and family members who are struggling with the high stress levels of hospitalization, this expectation has produced amazing results, as these comments illustrate. Self-Reiki is a great calming element to my day from a pre-op clinic coordinator. My personal practice has become very important to me, and I can calm my son more quickly, from a mom with a toddler who has had multiple surgeries. I often find myself throughout the day thinking of spreading positive healing energy to those around me, which has led me to be less judgmental and more at ease in difficult interactions, a nurse practitioner in the playground. Reiki practice exemplifies Janet Quinn's concept of self as healer, as Reiki practitioner principles frame practice parameters and illustrate their relationship to this concept. Come from my heart and not my head. Connect with the essence and not the personality. Be careful not to judge. Be willing not to know. Let go of attachment to results. Reiki is an energy field intervention categorized by the National Center for Complementary and Integrative Health as a modality for which measurement of its energy and movement is not yet possible. Reiki research focuses on comparisons of reported sleep, anxiety, or pain scores for cohorts using Reiki with those that do not, as well as patient, family, and clinical caregiver satisfaction, stress reduction, and well-being. Many studies are hampered by insufficient power and are problematic methodological strategies or reporting mechanisms. The gift of Reiki can be summed up in this report from one of our nurses. I use it with children while I am giving anesthesia. With my hands on the crown chakra, I notice a definite de-escalation of anxious behavior. The Parent Wellness Program is built on a delivery model that starts with existing resources and expands in stages as funding resources appear and as acceptance and support from the host system increases. A vision, mission statement, and strategic plan was developed at the inception. We are in our third year of implementation, entering phase 3 of this project. This model of development is adaptable in a variety of clinic settings. Thank you for your attention. If you have any questions, please feel free to contact us.